Thank you so much. Bagonza Steve, now my name is District Health Officer for Kasese District, and today we have been handling a budget conference, and in this budget conference we are looking at giving the priorities, highlights of the priorities we intend to do in the next financial year 2024-2025, and also giving a situation analysis of how we've been performing in regard to our performance indicators and the trends of performance in the health sector performance indicators, and this is actually what we have discussed today. Basically in health, our functional area is best looking at providing health services to the entire community through community mobilization, health system strengthening, support supervision, planning, research. There are a lot of interventions we do in health and ensuring that we deliver the minimum health care package elements. And as a district health office, our function is basically oversight functions and looking at how our facilities are working, how supplies arrive at the district medical supplies and how we deliver them to the communities for use. And in today's planning, basically we did some capital developments last financial year which were highlighted on, like the capital developments we did last financial year and we are continuing to do this financial year. Like there is a construction of a theater in Vugoye which is going on. There is a construction of a theater at Nyavirongo which we are upgrading to health center for. There is a construction of a theater, Nyavirongo construction of a staff house. We are constructing a NICU and neonatal intensive care unit in Bwera Hospital. We have upgraded the Bwera Health Center to a health center 3. The maternity is now complete. All of these interventions were for last financial year and have been carried out for this financial year, which we have spent over 1.3 billion shillings. And we were guided by the center that the budget estimates for last financial year are the budgets to be carried forward for the coming financial year 2024-2025. And what we have prioritized in this budget is looking at now, Mbunga was formerly in this financial year's budget, but the center didn't fund Mbunga. Upgrade by construction of a maternity. We are looking at upgrade of Mbunga now to health center 3 by construction of a maternity at Mbunga, which is likely to cost over 700 million. We are also looking at another hard to reach area, Mahango. First phase also construction of a maternity, also likely to first cost 300 million as first phase, and then we shall be adding on for completion. We are also looking at a staff house. Bohera, we have completed the maternity, but we feel there should be a staff house so that our midwives can be able to be accommodated and sleep there so that they can handle our mothers in such a rich area. We also have health facilities without sanitary accommodations, like in Koko, Nyakavingo, with Chiraru in the mountains of Wera, that is Chitolu sub-county. We are looking forward to have latrines constructed at such facilities for proper sanitation and hygiene at the facilities. Those are the few capital projects, activities that we do which are funded by Ministry of Health under PHC grant, PHC recurrent non-wage. Here we get funds which we give to facilities and much part remains at the district where we do the software activities in the delivery of the healthcare package elements like the supervisions of different programs like office maintenance, outreach programs, supervision of outreach programs by the district health team, conducting workshops, trainings, capacity enhancement of our staff. All these funds also come. They are also priorities of government and as for the district. Basically, the common challenges are cross-cutting issues which are external, and though others are within our mandate, but others are likely to be managed, are requested to be managed by the center. For example, lifting the wage bill. Our staffing level is still at 79%, but we require to have a staffing of above 90, and which district cannot be able to manage this wage. So it is the center to help us increase the wage so that we can be able to recruit. Another challenge is the infrastructure at facilities. We don't have staff houses. So you find our staff moving long distances for work that one makes them delay for providing service. We also have a challenge of the health center 2 levels. Government has passed, gave us a guidelines, and the resolutions were made that all health center 2s are going to be upgraded to level 3s. But up to now, we still have 62 health centers in Kasese at level 2. We only have 36 at level 3. So providing maternity services, providing antenatal services, so this one affects handling antenatal services for mothers, still brings a challenge. So we have a challenge of infrastructure, a challenge of staffing, a challenge of transport. We are required to be conducting outreach programs, acts to avail services reach the nearest community. But you find we are constrained. Even single motorcycles for people to carry out vaccinations, school health programs tend to become a challenge. Other challenges are internal, which we can manage in our systems, like the absenteeism of our staff. This one is an internal systems arrangement which we can work on, that attendance to duty, those simple challenges. You see, people have a tendency of using that word of theft of drugs being rampant. But as a health worker and profession, me, theft of drugs as a DHO, I have not witnessed it myself. What I can only hear is, if there is a police case, somebody has been arrested with the drugs. In my regime, in my period, there is no any arrest of any person. It is always a police case. If we hear of a theft of drug, let the police intervene. Let such a culprit be brought to book. He's arrested. It's when I can come in and I confess there is theft of drugs. There is no way I can confess on rumors.
Okay.
These are rumors I hear, but I've never witnessed one. Yes.
Okay.
Ladies and gentlemen, Rukoki being an only government health center for and in the center of the town, the business town. You see Kasese town, every person comes from Rubirizi connecting to Kasese, from Ubwera connecting to Kasese, from Songora North, Chavarungira, Wesumbu, all come to town as a central business place. So all these ones access services from Rukoki, being the only government health center for, which is at a free cost. So the drugs calculated for Rukoki do not meet the demands of the population being served by Rukoki. So Rukoki actually needs help. It even requires to be upgraded to a hospital level. If I had the mandate, this is the health center that would be urgently made a hospital, so that actually it can handle the population here. Most of our health centers around at health center 4 level are private, where there is cost. St. Paul, there is cost attached. St. Mary's, cost attached. And they are the hospitals that serve the population here. So if there could be a health center, Rukoki upgraded to hospital level status, it would actually serve this entire population. There is no theft of drugs in Rukoki, but the population being served by Rukoki, the drugs provided for Rukoki are less than the population it is serving. The only challenge now we have is we are now constructing the OPD block. There is a staff house we are coming up with. There is the renovation of the maternity which got banned, which is ongoing. So with the time, Rukoki is going to be very fully functional and will work.